And let's talk about the preparations being done regarding this third wave.
Well, Shahan, from what we know now, the Premier was saying to us there's about over 4,000 beds that they've added. They also have added over 5,000 of the health workers. And also, Shahan, they're already sending people on the ground to get older people to register. They're saying that over the weekend they registered over 20,000 on the last week, over 20,000 older people. The focus for the vaccine will be for 60-year-olds, and then they'll go down. Now, we do know that the province needs to have about 1.3 people that are older that needs to be vaccinated. So they're saying that there is some movement, because in order for them to reach immunity, you need to have vaccine in terms of vaccine rollouts. But at the same time, you also need people on the ground, Shahan, to avoid super spreader events, and also to people to behave. They actually exercise caution, saying that younger people tend to go out to these super spreader events, and it becomes a huge issue because they can fight it because their immune system is still okay, but the older people, it poses a significant threat for them. So these are some of the things that the Gauteng has already done so far.
So let's take a listen to what the Premier had to say.
Learning from the first wave and the second wave, so how better prepared and it's not just infrastructure but also health, additional health capacity. Its infrastructure, its human resources, is also health technologies to fight the pandemic. So relative to where we were in May last year, exactly 12 months ago, we are in a much better position.
And of course, the Premier is confident because he knows he's putting measures in place to deal with the third wave. But the Coronavirus Command Council in Gauteng is saying people still need to be cautious.
That's right, Shahan. They're saying that, again, the young people need to avoid these super spreader events. But also they're saying that what they've noted is that people in general have now relaxed. So people are not exercising caution as per usual. So this is why now it will spread much more. In fact, Professor was just saying that in 3 weeks' time, we're most likely going to see more and more numbers growing, because in the 7 days, they've noted that these numbers are growing. And at this point, they are saying that this is higher than before the second wave. So obviously, there is a threat there, even though they're saying that it's possible that this wave may not hit us as hard, but they're saying that there is possibilities as well. So people need to be wary. And they were just saying that Sedibeng is one of the areas that they're looking at, and they're seeing already signs of hotspots. Now, you will remember in the past that hotspots were the areas that they saw that this is where it was spreading. So now they're saying that in terms of the heat map wave, they're saying that they are seeing that Sedibeng is one of the areas that is now seeing signs of cluster there. And they were also saying that Soweto is also one of those areas in Johannesburg that is seeing a rise. So it's definitely here, but it's just signs for now, and they will see in time what it really means for the province. But let's listen in.
In the last 7 days, we have seen a spike. Actually, it's an uptick, because it's actually a sustained increase in the 7-day rolling average for more than 5 days. So we're now on day 7, where we've seen a sustained increase in the 7-day rolling average of daily new cases. So we have not reached the third wave threshold yet, but we are very worried. We're concerned about the spike. And there are a number of areas that are concerning us in the province. And that's the box on the right. I just want to talk to those issues a little bit. So in terms of the increase we've been seeing in the last 7 days, all our districts have seen an increase. Some of them at a lower level than others. The highest increase have been in Johannesburg, Tshwane, and Sedibeng. And then the sub-districts that are reporting the highest number of cases are Johannesburg D, Tshwane 3, and Mfuleni in Sedibeng. Mfuleni is actually the most worrying area. It has had the highest number of new cases per day, per week in our province for 3 weeks. It's been a sustained increase in Mfuleni, and actually the numbers in that area are approaching the third wave threshold. So that's a concern.
All right, it's going to be very interesting to watch how the province actually deals with this third wave. I also saw a report saying that the Premier was saying we're already at the start of the third wave in terms of the numbers we're seeing. That's right?
Yes, so the Premier is saying that we are in the beginning of the third wave. But basically, Shahan, you will remember that these are the signs. So what they looked for in the past is what they're looking for this time around. And they are seeing those signs. So if you talk about the hotspots, which is what we're hearing, if you talk about the clusters that they're noting, so these are all the signs that show that we are going towards that wave, but they are going to see in time just how hard it's going to hit us.
Yeah. All right. Thanks for the update. Appreciate it. Mobile Madlala.